All right. Hello, everybody. Thank you very much for joining me for another live Q&A session. So this will be on YouTube, X, and Instagram. As soon as Instagram lets me go live. Should be going up there now. Okay. So thank you all very much for joining again. I'm trying to do these weekly again. Schedule can be a bit all-consuming, so I don't always have the same start time. So thank you all very much for being flexible and understanding that. And we'll get into the questions. Here we go. We got a couple questions here, such as one from Michael. It says, doing sprinting, lifting heavy weights fasted. It uses glycogen for energy when moving intensely, but it uses your protein in your muscles to replenish the glycogen. How do ketones play a role? So that's only the case if you're in a carbohydrate metabolism, not in a ketogenic metabolism. You do not use your protein to replenish your muscle glycogen when in a ketogenic state. So people say that well, when you're working out and doing all this sort of stuff, that you actually start breaking down your muscle first. It's completely the opposite, actually. Your body it only does that when it is forced to, when you run out of fat. You cannot access your fat stores, and when you have high insulin levels. It blocks lipolysis. You cannot access your fat stores, and so you have to cut into your protein. But when you're in ketosis, that does not happen. If you're in ketosis, you will not start breaking down your muscles and proteins for energy until and unless you completely run out of fat stores, which is, good luck doing that. Like it's not going to happen. Not during the course of a single weight session. A 65 kilo individual with only 6% body fat, maximal glycogen storage with maximal carb loading is only about 2,400 kilocalories of energy in his muscles and liver, completely filled to capacity. But that same 65 kilo individual with only 6% body fat, that 6% body fat has over 35,000 kilocalories of energy available, right? So it's over 15 times the amount of energy in that 6% body fat, and most people are above 6% body fat, and so they're going to have way more calories, energy available to them in their fat stores, and you have to burn through all that before you get to protein. So we've seen this in controlled trials in physiology and sports medicine trials, such as from Volek and Finney, that actually showed that. In a faster trial in 2016, actually showed that ketogenic athletes actually have the same muscle glycogen and the same glycogen restoration as carb athletes that are sucking down packets of gels and things like that, just being in ketosis. So before a 3-hour run, after the 3-hour run, and then 3 hours after that, during recovery, they did muscle biopsies, 3 muscle biopsies, which is, they're not fun to get. So it's like, good on these guys for volunteering for that. And they found that the glycogen levels, muscle glycogen levels, were exactly the same for the keto group and the carb group, even though the carb group was carb loading and sucking down sugar and gels throughout their exercise and during their recovery. So you don't actually need to restore the glycogen with carbs or protein. Your body does not break down your muscles if you're in ketosis. So your body's constantly regenerating your glycogen when you're in ketosis. Breakdown products, you have you sort of have sort of these glycerol backbone, and you have these fatty lipids that are on that. You sort of this sort of triglyceride sort of structure that has that comes from your fat. That gets broken down. That glycerol backbone gets actually turned into carbs, sugar, blood sugar, and glycogen, and then these 3 fatty chains actually get turned into ketones. So as you are producing ketones, you are necessarily producing glucose and glycogen as well, just to a much smaller amount, right? The percentage of energy that you're getting is getting predominantly coming from the ketones. And then you get gluconeogenesis. This is part of that. That you're making these glucose molecules and then glycogen subsequently, and you're making that constantly. Volek and Finney also found in that study that after about 55% VO2 max, carb burning athletes, switch over to carbohydrate metabolism, which is why people say, oh, you have to get the zone 2 cardio, and then you'll be burning fat, and then after that, high intensity exercise, you have to have carbs. That's not true. Again, that's only if you're already eating carbohydrates and you're raising your insulin and you're blocking off lipolysis, so that you physically can't access your fat stores. Because in those ketogenic athletes, they found that they were actually oxidizing fat and burning fat for fuel at over 90% VO2 max. And that's actually what they found. And their performance, they were outperforming. No, sorry, that was VO2 max was okay. Sorry about that. For some reason, my internet decided to crash out exactly then. So, yeah. So, in the Volek trial, they found that they were oxidizing fat at well over 90% VO2 max, and that their athletic performance was as good or better than the carbohydrate athletes, and they were replenishing their glycogen as fast or faster than the carb athletes that were sucking down gels and things like that. So, what we have been told about exercise physiology is simply untrue, and it's largely to do with people that are just on carb metabolisms. And or in like things like the de novo trial, where they had carbohydrate and keto athletes, and they said, oh, okay, you go ketogenic and we'll see what happens. Even they found that within a week that they were oxidizing fat at over 90% VO2 max, but their performance had actually suffered. But they hadn't allowed them to keto adapt. They sort of basically, after a week or two, they said, okay, now we'll go compete, and that the carb athletes outperform them. But you wait just 6 weeks, and you actually Professor Noakes actually showed that you get no drop in performance, even very high intense sort of exercises like 800-meter sprints and repetitive 800-meter sprints, 800 after 800 after 800 after 800 after 800 after 800 after 800, because they wanted to show that this wasn't just residual glycogen in the muscles that they were running on, that there's actually ketones that they were running on. So that's the thing, they allowed them to actually get fat adapted. And then McSweeney showed after 3 months of fat adaptation that the carbohydrate athletes were actually being beaten by the keto athletes. So the keto athletes were outperforming the carb athletes in not only a 100-mile run, but also a 6-second sprint and then a critical power lifting test, right? So every way that you can move your body athletically, the ketogenic group beat the carb group. And also you're not getting all the metabolic stress and harm, hormonal disruption, joint degradation from arthritis, because glucose damages the cartilage. You're not getting all the gut issues and other sorts of forward problems that you get from eating plants and carbohydrates, all the inflammation, etc. And so you're just healthier in general, and you're outperforming the competition. So it's like, this is a no-brainer, really. And so yeah, I have a very in-depth lecture where I talk about a lot of these things. I go into more detail with those studies and others as well. On YouTube, it's just called Ketogenic Carnivore Athletes, and that was at a medical conference that I spoke at last year. So you can check that out for more. Okay. All right. Thank you to Rosa for joining the YouTube membership. It's great to have you. Hopefully you get a lot out of it, and glad to see you here. Question from Jonathan Vaughn. He says, can you do carnivore if you have high blood pressure? Yes, and it's it can be a very good idea because there are a lot of reversible causes of high blood pressure that are actually pretty well and truly diet related. So high insulin can cause high blood pressure due to sodium retention in the kidneys, as well as increasing the thickness of the muscular layer in your arteries. And so that can actually cause a thickening and tightening so they can't release and be compliant and open up and reduce your blood pressure. So those can be reversed by reversing insulin resistance by going ketogenic carnivore. Also, homocysteine, high homocysteine levels, which is a consequence of low B vitamins, B12, B6, B9. B9 is folate. People usually know it as that. And so if you have low levels of those B vitamins like B12 and B6 and things like that, which are very common if you're not eating enough meat because you can't get B12 without eating meat, your homocysteine might be elevated. You typically want it lower than their reference range typically wants it, and if you have it, if it is sort of higher than what is optimal, it can actually cause damage to your arteries. It actually potentially cause atherosclerosis because it's causing damage to your artery walls, the endothelial layer in your arteries, and that can cause buildup and scarring of the plaques, etc. And can cause irritation and can cause a constriction of your arteries as well. And so just correcting your homocysteine by eating more meat can also improve that. Then being ketogenic also will improve that from an insulin point of view as well. And there very well may be various plant toxins that cause irritation and issues with your hormonal regulation of blood pressure control also. So a lot of people find that for various reasons, that by going ketogenic carnivore, that after a few months, actually the blood pressure comes down. And so quite a lot of people get a much more well-controlled blood pressure. Sometimes they can even reduce or even come off their blood pressure medications. So it's important to work with your doctor to see if that's something that you need adjustment on. You do not stop your medications without talking to your doctor because it may not be appropriate to do so. So it's very important to work with your provider. But be aware that you could get to a point where you're on too much medication. You could start getting dizzy and you could start having problems. And if you stand up from a chair and you're getting a little lightheaded and you're getting that regularly, you could very well be on too much medication. And so talk to your doctor and see, or check your blood pressure and get some data points and say, hey, I'm running about in the sort of high 90s now. Should we think about maybe changing my medication dose, those sorts of things. So just be aware of that and work with your doctor. But yes, you can absolutely do carnivore with high blood pressure, and quite often it can help as well for those reasons, and probably more. So next question from Sophia Longoria. Thank you so much, Sophia, for the super chat. I really appreciate it. Question is, carnivore for 1.5 years, only beef 80-20, diarrhea almost every day. I avoid rendered fat. I make sure to eat enough protein and fat. Also noticing hair loss. Not sure what's going on. Well, hair loss can be from a multitude of issues, including things like hypothyroidism. And so if there's some sort of disruption in your thyroid, there's a lot. Carnivore can help thyroid dysfunction in a lot of ways. It can help put Hashimoto's or reduce the effects of Hashimoto's, potentially even put it into remission. It can remove a lot of the plant toxins called goitrogens that cause thyroid dysfunction. It also improves the nutrients, things like zinc and selenium in particular, that can improve thyroid dysfunction as well, obviously getting enough iodine. So some people can have low iodine anyway. They can have low zinc or selenium, especially in places like Australia where there's not an abundant supply of these minerals in the soil. So if the soil health is not healthy, then you may not be able to get these vitamins, minerals, and things like that. So you can think about that. You can try checking your thyroid, checking your iodine, if you're checking your thyroid, you want to check TSH, T4, and T3. T3 being the key one there, because that is the active form of thyroid hormone. So you can have normal TSH and have normal T4 because you're making a lot of thyroid hormone. That's fine, but if you're not converting that into the active form of T3, you could actually be hypothyroid and you actually be symptomatic, and there can be other symptoms of that as well, sort of lower pulse, lower body temperature, especially on waking. Those can be signs of hypothyroidism. There's a lot of other ones, hair loss being one of them too. And so, just checking that, make sure those things are optimal, making sure your vitamins like, vitamins, minerals such as, or really minerals in this case, such as iodine, zinc, and selenium are in optimal levels as well, because those are really important for your thyroid function. Diarrhea every day. You didn't mention things like coffee and tea, but that is the most common cause of loose stools on carnivore, because they're laxatives. That's just, they cause your increased motility, and they're also anti-nutrients, and they can block out the absorption of a lot of things as well, which can contribute to other sorts of problems throughout the body. So 80-20 ground beef is usually not too fat for people. I've even seen people have add a whole bunch of salt, because they're told that on carnivore you have to have tons and tons of salt, which don't actually. Some people need a bit more salt when they're transitioning and getting fat adapted and reducing that insulin resistance, because of that relationship I spoke about earlier with insulin affecting sodium retention in the kidneys. And so when you sort of are normalizing that you can all of a sudden spill out a bit more electrolytes, but that doesn't mean that you need just gallons and gallons and gallons of seawater. So it's it's important to just be aware of that. But I've seen people adding a whole bunch of rock salt and things like that, a whole lot of salt to their water, and they were getting loose stools from that, because you actually give yourself diarrhea from just having a severe excess of salt. You simply cannot absorb this stuff, and then water follows salt, so you're retaining a lot of water. You're not absorbing it necessarily, but also you can actually pull out water from your intestines and from your body into your intestines, and you sort of get this osmotic diarrhea, and some laxatives are osmotic laxatives, where they actually pull out moisture from your body into your intestines and just run that through. So those sorts of things. So I don't have enough information really to go on, so I can just sort of give you some things to maybe address. If you're eating anything besides meat and water, cut it out. A lot of things can cause those problems. If you're adding tons of salt, cut it back. Certainly don't add tons of salt to your water. Coffee, tea, artificial sweeteners, usually in the coffee or tea, even stevia, those sorts of things, all can cause loose stools. But even medications such as metformin, very common for people to be on. It's a diabetes medication. Some people even take it for just longevity. They want to have a sort of there's animal studies showing that it can improve longevity in animals. The human studies are being done now, but that's sort of only in animal studies at the moment. So some people will go on metformin for that reason, anticipating to get that good result from the human trials. But can cause loose stools, can cause GI upset, and so can even supplements such as magnesium. Magnesium can absolutely cause loose stools as well. So all these sorts of things. So just keep those in mind. You're avoiding rendered fat. Sometimes 80-20 is not like really all that much fat. Most people do just fine with that. I don't think it's too lean either. You can get, if you're really lean, you can sort of get that over excessive amounts of protein, and you sort of call it protein poisoning, can also cause watery diarrhea. So sometimes if you have too little fat, you can also get watery diarrhea as well. So you play around with that. Usually 80-20 is not too lean, but maybe your body just needs a bit more fat. Maybe it needs slightly less, but ground beef, is going to render out a lot of that fat too. So it might be more lean than you actually think it is, depending on how much you cook that, and how much of that fat that comes out of it. If you're like, well, that's rendered fat, I'm not going to have that. Well, then that meat could actually be very lean, and you could actually be not getting 80-20. You could be getting 90-10, and that may be too lean. So these sorts of things. And then other people will find that, even just avoiding even cooked fat and just eating it uncooked can actually help with that as well. But there's a lot of other things going on there. So unfortunately, I sort of have to do a broad sweep, because there are a lot of things that could be at play there. And then the hair loss things, you have to look at your nutrients, get a look at your thyroid, and talk to your doctor and things like that. You've been carnivore for 1.5 years. Usually there's a transition period where your body is kicking over to a ketogenic diet. You trigger a fallout phase, and then that regrows. So usually that doesn't come a year and a half later. So if it is a year and a half later, you need to think about your vitamins, your minerals, your nutrition, your thyroid, and what products you're putting on your hair as well. Because there's a lot of products that actually cause hair loss. They're actually designed to cause hair loss, which is just bullshit. But look into that as well. Think about what you're putting on your head as well as in your body, and then check your nutrients in your thyroid as well. And good luck. Hopefully that gets better. So Rachel Waters, thank you so much for the very generous super chat. I really appreciate it. Rachel says she's a 71-year-old female. PSA is 6.2. Eats meat salad, 1/4 cup of fruit, 3 ounces of cheese, and 1 cup of coffee per day. 6 weeks after PSA is now 7.2. Now Lugol's, are you maybe TSA? Because you're talking about Lugol's iodine. Now Lugol's iodine and no fruit. Won't do all meat. Family history of some letters and acronyms. PGF, early cancer deaths, worried PSA, signs of BPH. Any thoughts? Are any fruits okay? Thanks. Well, PSA is normal for prostate, right? So there's really only men that have prostate. So benign prostatic hypertrophy is typically from the prostate sort of around the internal sphincter for the for the bladder, and when that gets sort of enlarged, it can block off the urine flow. I thought you were sort of talking about maybe TSA or thyroid stimulating TSH, thyroid stimulating hormone, because you were talking about Lugol's iodine, because that's typically what people take for thyroid issues. I don't think that's probably going to be an issue. I don't know why your doctor would be checking your PSA, because typically that's something that just affects men. And so if you're saying a 72-year-old or 71-year-old woman, so that shouldn't be as much of an issue. But either way, for men that are dealing with BPH, I mean, the PSA is typically, you're sort of looking at that sort of coming up and up and up, and you're sort of wondering, is that could be something to do with like prostate cancer. If you are getting sort of an enlarged prostate, that being the internal sphincter for the bladder, that's going to just cause urinary retention. So if someone's having urinary symptoms such as incomplete voiding, they have a lot of urgency when they need to pee. It's an emergency, or they feel like they have to go all the time, but they can't actually get anything out. Their stream is much weaker. If they're sort of standing in front of a wall, their stream can't hit the wall in front of them, do like just a strong stream in front of them. That can be signs that things are getting sort of scrunched down, and it's not necessarily just a result of PSA, although that can be indicative of that. Things that can affect the prostate, often insulin. Insulin is a major growth factor for the prostate. It's a growth factor generally. So insulin is an anabolic steroid. It causes things to grow, typically your fat. It causes your fat to grow. And just because something's anabolic does not mean it's just making muscles grow. It can make other things grow too, such as your fat. It can help with muscle growth and getting proteins and carbs and energy into muscles as well, but it causes a lot of other things to grow as well, and much more readily. So it causes your fat to grow. It causes your prostates to grow. It causes the muscular layer in your arteries to grow, like I said, and can contribute to high blood pressure. It can cause skin tags to grow. It can cause rectal polyps to grow. It can cause uterine fibroids to grow. So all these sorts of things are stuff that insulin does. And so that's something that can be quite sensitive when you do go ketogenic. And so cutting out cutting out at least the sweet fruits, then that can help. And trying to cut out everything with carbohydrates, or being ketogenic, it can be very helpful with that. And so if you're going to have some fruits, maybe stick to the non-sweet fruits. And you want to have any fruit you want to have. You want to avoid nightshades, so potatoes, tomatoes, eggplants, peppers. That's just a rule of thumb. Very high in lectins and plant toxins that you want to avoid, like solanine. But you also want to have fruit that have been ripened on the plant, because when the fruit's unripe, the seed's not ready. And so it wants nothing to eat the fruit when the seed's not ready. And so it has a higher concentration of toxins while the seed's getting prepped. And so once it ripens on the tree or on the vine, then the plant will actually remove a lot of those toxins. But if you pick it green, which is normally what we do when we get fruit in the stores, it's always been picked green. It's usually a year ago picked green. And it's like rock hard, like an avocado. It's just like a rock every time you get it. And then you ripen that in a box somewhere. But those toxins stay in there. They don't just dissipate, right? Because it's a closed system. There's nowhere for it to go. Right? They don't just break down into harmless byproducts just because you want them to. It's like they're still there. And so studies have actually shown that, specifically in tomatoes, that if you pick them green, they have far higher toxins, far higher lectins, far higher solanine, and they don't go away if you box ripen them, right? So that's important to remember. And so maybe stick to the non-sweet fruits. Certainly don't have fruit juice or anything like that. Don't put any sweeteners in your coffee. Even artificial sweeteners can give an insulin response. And so you want to try to keep that insulin down as naturally low, physiologically low as possible. And that's going to help minimize that growth response that you get from insulin. And so if you're going to have some fruit and things like that, just try to avoid the sweet ones. The sweet ones are way sweeter than they would be in nature anyway. They've been modified by humans to be massively sweeter, and so there's a significant amount of sugar there. The fiber does not cancel all of that out by any stretch of the imagination. It can block out some of it. Maximum 30%, but that's when you're getting 70% of this stuff minimum, and probably more like 80 or 90% depending on what you eat. So that's important to remember. And so if you're going to eat fruit, eat it seasonally, locally. Pick it from your own tree, ripe, and those sorts of things. And that can be better. Try not to have sweet fruit, and because you want to be ketogenic in that case. So good luck with that. But hopefully that helps. Next question is from Stephen Griffith. Thank you so much for the super chat. I really appreciate it. Stephen says, I have a spot on my head where the hair isn't as dense as the rest of my head. Can carnivore help? I have not been diagnosed with anything. Well, it really depends on what's causing that. When you have sort of like focal alopecia, that can be an autoimmune condition. Depends on how long it's been there. Usually with sexual autoimmune disorder, you can get that spot and you can sort of build up pretty quickly. Fungal infections as well. If you have some sort of skin, sort of flaky skin or something like that, that may be something to do with that, like a fungal sort of issue. Improve your immune system generally, but it's not necessarily going to get rid of a surface dermatological fungal infection. So like antifungal shampoos and things like that might be able to help with that. Things with like Nizoral, I think is a kind of antifungal sort of shampoo that sort of helps with that sort of thing. But you can ask a pharmacist. And so the other side is that when you're talking about focal patch, that could be an autoimmune sort of condition, and absolutely you can have massive improvements by going carnivore if it is an autoimmune condition. And I have a video on rethinking autoimmune diseases. That's on the Low Carb Down Under YouTube channel, and I'll be actually adding to that because I've had further thoughts since then. I've had further thoughts since then that I was going to sort of add to that, and then I'll publish that on my page as well. But people can find that now, and you sort of get my thoughts on that. But and then what I think is actually going on with the so-called autoimmune conditions, and what and why a carnivore diet helps with that. But at the end of the day, you can just try it, and just see how it goes. You just try. If you are thinking this is potentially autoimmune, then just try a Lion diet. Just try beef, lamb, and water for a month. Cut out coffee. Cut out everything that can have these lectins and toxins that can contribute to these autoimmune sort of issues, and just see how you go. And if it helps, great. Then it was something that could help with it. If it doesn't, it doesn't. But at the end of the day, you're going to get better anyway. You're going to improve your health in a lot of ways anyway. And we don't know exactly what's causing that thinning in that one particular spot. But odds are good that might be something sort of topical sort of issue, like a fungal issue or an autoimmune issue. Those are more common for what you're describing, that focal alopecia, or commonly one of those two things. It could be other things, but the thing is, you can just try and see if it helps, and if it does, great. You try different sorts of things. Obviously, hair loss generally, it's usually more global. It could be a thyroid issue, and so and then again, of course, the different sort of products that you're using on your hair, are those contributing? You should think of those as well. But at the end of the day, if you just try carnivore diet, see how it goes, see how it helps, that may very well help. And if it doesn't, well, you'll get a whole bunch of other improvements anyway that we didn't have before, and you'll feel good. You'll feel glad that you did it anyway. But you just try. Might as well just try and see how you go. Kim Cluckers just had a comment. Thanks. Down 43 pounds and feeling great. Well, that's great, Kim. Congratulations. Really proud of you, and keep up the good work. And thank you very much for being here and for sharing. Okay, let's see here. Oh, and then Neil has looks like there's maybe a question didn't get attached to that, so maybe there's something down the road here that might pop up. Okay, we'll go to the next one for now. Next one is Carney for Health. Thank you very much for the super chat. How would you suggest for meningioma brain tumor behind the eye, around the optic nerve and carotid artery behind the eye? Radiotherapy has been suggested. So certainly work with your team, work with your neurosurgical team, and there are certain protocols that have quite a lot of human trials and testing to support it. So certainly work with your team. When you're talking about things around the optic nerve and the carotid arteries and these sorts of things behind the eye, oftentimes they're not operable, but sometimes they are, and sometimes you can get certain debulking and then sort of try to hit the rest with radiotherapy. Sometimes it's just radiotherapy. Fun fact: there are studies that have actually shown, preliminary studies, not massive, large-scale randomized controlled trials, so preliminary studies, but studies in humans showing that you actually can improve and even shrink, or at least slow down, the progression of meningioma, and potentially even shrink by going on a ketogenic diet. Again, insulin causes things to grow, and so insulin can be responsible for that, and also these sorts of disrupted when you disrupt the sort of the cellular growth signals for these cells, even if it's a benign tumor like a meningioma, which is not cancerous, it's still growing inappropriately, right? So you got unregulated cell growth, right? It's just not malignant and capable of metastases unless you get like a grade 3 meningioma, which does act in more malignant fashion. But those are quite rare. But just benign is unregulated cell growth. Okay, so what regulates cell growth? The mitochondria. The mitochondria stop a cell from dividing and growing if it's damaged and not appropriate to do so. When you damage those mitochondria and they're not functional, then they can't regulate that cell growth. Great. Ketogenic diets help improve mitochondrial function. Also, because they have damaged mitochondria, they have increased glucose demand, and they don't have the capacity to run on ketones, just like cancer cells, because of that damaged mitochondria. But you can have other benign tumors and growths that still have that same requirement for increased glucose because of those damaged mitochondria. Okay, so going ketogenic and limiting the amount of fuel that's available to them limits their growth potential and potentially can kill these cells and have them shrink down, or reverse and fix and help the mitochondria, because being in ketosis and lowering your insulin kicks on autophagy. It's not fasting, it's lowering your insulin. Insulin blocks autophagy. Okay, so just fasting lowers insulin. You know what? Not eating carbs lowers insulin. It's just the insulin side of this that's the important thing. And so you're going to turn on autophagy, which you turn on mitophagy, and you increase mitogenesis. So you replace and recycle these broken down, damaged mitochondria. You replace them with newer, faster, younger mitochondria that work better and can actually say, like, "Whoa, hold on a second, we shouldn't be dividing like this. This is crazy. Shut it down." Right? So interestingly enough, again, there are preliminary studies showing that this can be helpful. Ketogenic diets can be helpful. So worth trying. And just coincidentally enough, I was actually speaking with someone who reached out to me a couple of years ago, and they had a meningioma sort of in a similar area. It was actually invading in the optic nerve, and they were going blind. And they just went, "Screw this, I'm going carnivore," and it's actually shrunk, and it's continued to shrink. And now she actually has returned that vision in her eye. And so I was actually just talking to her last night about publishing her as a case report in the literature, because it's pretty important for people to know about that and get more information out there, so that we can just say, maybe, hey, why don't we do a larger study on this? Why don't we take 20, 30, 40 meningiomas, and we'll do standard of care, and we'll do standard of care with ketogenic. The lady I spoke to that had this very significant reduction in the meningioma and return of vision in their eye, recovery of their vision in their eye. I don't think they were fully blind. They were just losing vision. Now that's recovered. She was saying that she went ketogenic, and that dramatically slowed down the growth, and really just slowed it down to a crawl or a halt. But it wasn't until she went carnivore that it actually started to shrink, which is interesting. That could potentially be something to do with lectins. Lectins can bind to insulin receptors 5 times more tightly than insulin. So potentially that's giving sort of growth signals. Who knows? There might be something else involved. Maybe she was just even more ketogenic when she was carnivore than she was before. Some of the artificial sweeteners or other sorts of things that maybe don't keep you into as deep a ketosis or whatever. Who knows? But either way, whatever happened, it happened. And so she had a big improvement after she went full ketogenic carnivore, on top of just being ketogenic on top of that. So that's what I would sort of recommend. Listen to your doctors, work with them, and but also you can add in a ketogenic carnivore diet, and you can just see how you go, and it can help salvage a pretty unfortunate situation where you have sort of a typically inoperable or only partially operable meningioma, and get it to the point that maybe you don't even need much in the way of therapy, which would be great, because no therapy is without risks, especially in that area of the brain. And if you can avoid any sort of surgery or any sort of serious treatment for these sorts of things, always the best thing to do. Always the best thing to do. So have a think about that. And yeah, good luck with that. Hopefully it goes well. From Bob Nagesh Eldridge, thank you very much for the super chat. Bob says, have you heard of can long-term patellar tendonitis be reversed on carnivore? So patellar tendonitis. Well, I'm not sure. I haven't heard anybody one way or the other. I mean, it can reduce inflammation and can sort of help just the body heal and repair generally. I actually had pretty bad tendonitis and tendinosis. And tendinitis probably would help. You're going to reduce the inflammation quite significantly, and most people find that their inflammation reduces dramatically as well. And so it could very well help with it could very well help with the inflammation and sort of the symptoms of that. So hopefully it does. Tendinosis is when you actually get sort of, breakdown and degradation, little partial tears and regrowth, and then you can actually have little gaps and damaged tissue. I had that, and I sort of was just a lot of, and that was during the period of my rugby career that I wasn't carnivore. It was like a couple years after I stopped carnivore, so I don't know if that contributed to that. That my patellar tendons weren't as protected. But I started getting that, and I started, I would hear this big pop in my patella and be like excruciatingly painful. I'd just be hobbling around, and it just kept happening, and that really sucked, because I was like mid-season, and was like coming up on the trials for like the 2007 World Cup were coming up, and I'm like, this is not a good time to have my patellar tendons like screwing up. But I was able to, to keep playing, but it was not fun. And then like years later, I ended up actually doing PRP. And there's sort of mixed evidence on that, but at least for me, I found it massively improved. Got a good 70–80% improvement with the one treatment. And then I got second follow-up treatment, and that was it. I've never had an issue with my patellar tendons again. So that was really good. It was excruciatingly painful. I mean, just beyond anything I'd ever experienced. So it's not something that I would do lightly. It's very, very uncomfortable. Like, you're not supposed to be injecting anything in those tendons. Like the stretch receptors on my tendon sheath were just screaming. It's just like, what the hell is going on? I felt like my knee was just gonna explode out, out while the doctor was injecting stuff in. It felt such intense pain. I couldn't bend my knees at all. I was just hobbling straight legged, and then I had to drive home, and I was driving a stick, and I had both my knees done. I'm like, this is a bad idea. I should have got someone to drive me, or just done one at a time. But yeah, trying to stick shift through Seattle traffic, like rush hour traffic, stop and go for like 2 bloody hours ago, 5 miles, was not fun. And that took a few months actually to recover from. But if you're not to that extent, I mean, it's definitely worth a try. You're going to reduce the inflammation, and we look at damaged cartilage, and it looks like there's glycation damage. There is glycation damage from high blood sugar in these damaged joints, and so who's to say that you don't get damaged tendons from the same thing? I don't know if they've ever done that. I don't know if that's a really feasible thing to check. You might be able to do it with like cruciate ligaments and things like that. You blow out your ACL, and maybe you can sort of scrape off some of that and see if that's damaged and glycated. Can't really probably do that except like a post-mortem on a patellar tendon though, because you need those, and you don't want to take a biopsy out of a living tendon that actually has a role to play. So who knows? You can always just try it and see how it works again, and see if that reduces the inflammation. Then great, and it sort of heals and repairs. Then lovely. That's the best thing to do, and you'll be fine. And if you're past that, and you're sort of got the tendinosis side of things, then take a think of and it helps, but it doesn't get rid of the issue. Then you can always think about talking to your doctor and see if PRP is suitable for you. It's not cheap, there's out-of-pocket expenses and things like that. It is bloody painful, and it takes months to recover. So just a heads up, it's probably twice the recovery of whatever they tell you. Just double that. My own experience was they said that 6 weeks would be back running and playing. It was 3 months for me. So that was not fun. But yeah, give it a shot. Let me see. Where are we at now? How long have we been doing this? About 40 minutes. Why don't we just turn off the super chats just for now, and we'll see how we're going. But then down the line, maybe we'll turn back on depending on what time. I have more time today. I can go for a couple hours, so we'll see. So next question is from Seven. Thank you so much for the super chat. Hi, Dr. Chaffee. My wife has hyperemesis gravidarum, part of her pregnancy. How would carnivore diet help with it? Well, first of all, I'm very sorry to hear that. Hopefully that does settle down. I have seen quite a number of women who have had hyperemesis for months and months and months. A good friend of mine had hyperemesis for 32 weeks, and it was the day she cut out all plants that stopped, and it stopped on a dime. So when you're having, very serious hyperemesis, you got to remember that your body is trying to protect this baby, and it's going to be much more sensitive to various toxins. And so if you're eating, all sorts of, plant toxins and things like that, that could very well trigger your system to say, absolutely not, let's get this stuff out of here. Just like alcohol poisoning, your body's just, no, get this out. We can't afford to have anything else get in here because that can hurt us, or in this case, hurt the baby. So it could very well be that she's getting even more sensitive to things that she normally would have eaten without any issue, but now her body's just saying, absolutely not. We're not taking any chances on that. And so it's an elimination diet at the end of the day. Well, at the end of the day, it's our proper human diet. It's our naturally biologically evolved diet. But it's also, you can think of it as an elimination diet. You're just eliminating out all these different potential options that could be causing this issue, right? So it's definitely worth a try. But yeah, that's what it would be. You'd be cutting out things that could be triggering that hyperemesis response. And so hopefully that settles down. And I think it's worth a try, certainly. I mean, she and the baby need those nutrients, those fat soluble vitamins that only come in meat, and the water and fat soluble vitamins that only come in meat, the B12, the vitamin D3, the cholesterol, the saturated fat, the DHA, the EPA, those sorts of things, the arachidonic acid. These are required and vital. Choline, creatine, carnitine, those sorts of things are extremely essential to normal neurological development and functioning of the body during development. So those are really, really important. So those are nutrients that she can't do without, that the baby can't do without, and will be significantly hindered if they don't get. So certainly worth doing that anyway, because from just a straight nutrition point of view, it's really important. Having a bit of liver, 3-4 days a week, really good idea during pregnancy and breastfeeding. Great idea. Your demand for nutrients is greater during that time for you and the baby. So it's very important to be as flush as possible. So, and also you're getting rid of a lot of things that could potentially cause harm, which hopefully will settle down her hyperemesis. Good luck with that. It's not a fun thing to go through, for sure, to say the least. So hopefully she gets better, and then hopefully this helps. Good luck with that, and congratulations. James Stein, thank you very much for the super chat. Can carnivore reverse supraventricular tachycardia? Maybe. This is interesting research coming out from India, from a good friend of mine, Dr. Ankur Verma, who's actually finding that there's a lot of people with SVTs that are coming in that have really, really, really elevated homocysteine and low B12. And so he's finding that there's a strong correlation there. So potentially you're getting this irritation and damage, and maybe that's from the homocysteine, maybe that's causing a bit of an issue. So you think about this, when I talk about animals, you have animals that get big head, big tongue, limp neck, crazy cow syndrome. Those are all diseases that actually come from eating the wrong plant, that are toxic to an herbivore, right? That only eats plants. But also they get things like muscular dystrophy. In cows, it's called nutritional muscular dystrophy, because they figured out it's actually a selenium deficiency in cows, and that's how they get muscular dystrophy. Okay. So how many diseases, how many issues are we getting that are one of those, or a combination thereof, where you're eating things that are toxic to the body, and your body's reacting and responding in strange ways that are abnormal, that we call a disease, or that that you have a malnutrition issue, and you don't have enough of something like B12, where you're then not going to be able to metabolize homocysteine properly, and then all of a sudden that's going to get out of control, and you're going to get other sorts of damage in your body. And so he's finding this is a vegetarian population. They don't get almost any B12, and so homocysteine through the roof. Oh, but your folate will do it. No, sorry, dude. Like, it's just not. It's not cutting the mustard. People's homocysteine are 10 times, 20 times, 30 times higher than they should be, than a healthy optimal level should be. And their B12 is extremely low. You get folate from plants. Not enough. It's not enough to take care of these sorts of things. So B12 is really important for that. So is B6. So he's finding that there's actually a strong correlation with these vegetarian people with high homocysteine and low B12. They're actually getting SVTs. Interesting. And there's probably other sort of nutritional relationships as well. But you can see, and I don't think we have any hard evidence one way or the other. We just have sort of these signals and some thought-provoking correlations that we've seen with Dr. Verma's work, for instance. But worth trying. It's not going to hurt, at the very least, and it could optimize your health in a lot of ways, and hopefully improve things. And I hope it does. But at the end of the day, you can have the most amazing, well-designed study ever with just 50,000 people, randomized, controlled, locked in a basement, not allowed to do anything except exactly the intervention for 20 years, and they say, this really helps condition X. And you have condition X. It's like, great, I'm going to go do that thing. And then it doesn't help. It's like, okay, well, who cares? Or you have somebody who says, hey, I tried this carnivore diet and it helped me with that. And you're like, all right, screw it. Very low level of evidence, but you try it and it works for you. Who cares where the advice comes from? If something works for you, it works for you. So when you get these studies, what these studies can do is they help guide your decision making. And so you just say, okay, is there enough evidence for me to balance the cost benefit analysis? Is this of enough benefit that I want to do this? Is it worth giving up ho-hos and donuts and and a side salad? It's not going to hurt you. So it's not like, it's not taking this medication. Do I want these side effects, these potential side effects and health ramifications? But I really want this health benefit. It's not even that deep. You just it's like, it's not going to hurt you. It's going to benefit you in a lot of ways, but are you willing to give up that which is making you sick? If you're willing to give up, all these other sorts of things, on the idea that it might help your health. It will help your health in a lot of ways. Could it help with that? Maybe. So, you can just give it a try and see. And if it does, it does, and that's the only thing that matters. But I can't say that it will. There's an interesting preliminary sort of hypothesis generating work being done by Dr. Verma now, and he's seen these correlations, which is really interesting, specifically with SVT. So it's worth a try. It's going to help you in other ways as well. And if it does help you with that, please do report back and let us know, because that's getting more. Or even if it doesn't, just let people know, because we sort of need to know where we should go with different research, and say, like, okay, hey, look, we're getting a strong signal here that people with SVT or whatever are being helped by X, Y, and Z. Maybe let's put a study together and do that. And so that's important to let people know about as well. Good luck with that. Okay, so the one lady T, thank you very much for the super chat. Been doing strict carnivore since July. Can't lose any weight or fat. I'm a 54-year-old woman who eats beef mainly. One time on carnivore, lost 55 pounds, gained 45 pounds. First time on carnivore, lost 55 pounds, gained 45. So I'm not exactly sure. So you lost 55 pounds and then you regained 45 pounds, or I'm not exactly sure what that's saying there. But in any case, there are a lot of different reasons why people are slow to lose weight, and be a lot of hormonal reasons. I mean, you're 54, so most women are sort of entering into menopause or past menopause at that point. That can certainly disrupt or make things more difficult to lose weight, certainly at first, but eventually it does happen even for postmenopausal women. things like leptin resistance, insulin resistance, these sorts of things can make it very difficult to lose fat at first. And also, there's a difference between losing weight and losing fat. If you want to lose fat, you don't want to lose weight, just from any angle. Because if you're losing lean body mass, you're losing weight, but you're losing weight that you can't afford to lose, and that's what the problem. That's one of the main problems with Ozempic and those sorts of weight loss drugs, is that 40% of the weight that people lose is lean body mass, which is like you cannot afford to lose that, especially as you age. It's so hard to get that back at any age, but certainly at at the more extremes of life, it's not healthy to do that. And the weight that people regain typically is fat, so you end up gaining more fat. And actually, the weight that you lost is all lean body mass, which is, it's like the proverbial deal with the devil. It's just a bait and switch. Like, hey, you lost weight, but no one told you that it's because we chopped both your legs off. You know what I mean? And it's like, well, I don't weigh as much, and so it's like, yeah, but that's not what you were going for, obviously. So, you can work out, you can lift weights, you can sprint, which are very, very healthy and do help with fat loss. But they also can make you put on muscle, which makes you gain weight. Maybe it keeps you even, so you're losing this fat, but you're also gaining muscle, and your weight on the scale stays about the same. But also, you can have hormonal imbalances. Very important to look at, like insulin resistance, leptin resistance, those sorts of things. And those will just take time. And so there's 6 major things that affect leptin. Insulin blocks leptin. Fructose, sweet part of sugar, independently blocks leptin and raises insulin, so it hits you twice. Alcohol blocks leptin. Lectins, the plant toxins, block leptin. Cortisol, stress, poor sleep, block leptin, interrupt your metabolism, can help make it difficult. Well, can store abdominal fat, make it difficult for you to lose fat, especially abdominal fat. And then blue light, strangely enough, that the artificial blue lights especially from the LED lights from our computer screens. I never have anything that doesn't have very serious blue light filters on my screens, all of them, at all time, day and night. Just never have anything that has just normal glaring bright white blue light. I get out in the sun, get real sunlight, natural sunlight. Try to use blue light blocking glasses after dark. Keep the artificial lights down. All those sorts of things can free up your leptin and help your leptin resistance go down. And once that gets down to an appreciable degree, you can lose a whole bunch of weight very quickly. But I noticed that in my patients that have difficult time losing weight, 100% of them have elevated leptin and leptin resistance, 100%. And so you have to address leptin in that way. Those are the 6 major factors that I've found that keep people from getting their leptin resistance down. And when they are able to address it, so Carnivore just hits you 4 of them right there, and then you're addressing stress and sleep, and then the light side of things, you're home, right? And so that is that's something that I see, and I see leptin just coming down, and then when it comes down to just some sort of watershed moment, all of a sudden, woof, weight starts dropping off people's bodies. There can be thyroid dysfunction. You can have hypothyroidism. Check that. Check your T4 and T3, because that's the active form. So you can have normal TSH, normal T4, and then abnormal T3, right? So you may not be converting T4 into the active form of T3. You're hypothyroid, or especially if you're symptomatic, if you're low body temperature, if you have low heart rate, especially in the mornings. If you check that first thing in the morning, you check your body temperature and your heart rate. If that's your heart rate sort of, in the 50s, and your body temperature is sort of like, 96, under 97, sort of down like, like sort of 36 degrees or below Celsius, that can actually be a stronger indication that you're hypothyroid than even blood tests, right? And so like symptomatically hypothyroid, which is, the only thing that really matters, just because your numbers are a bit different doesn't mean that you are actually deficient in that hormone. So that can indicate it's symptomatic hypothyroidism. And so you check those sorts of things, and you check your vitamins and minerals and all these sorts of things. Make sure that your B12 is optimal. Make sure that your vitamin D is optimal. Your zinc and magnesium, selenium, all these other sorts of things are optimal. Using a bit of organs if you need to, if you're really low, or specific supplements, those can help too. And then those can all help your body basically realize, hey, we're not in a famine anymore. We can sort of let go of these things. Also, if you say you're strict carnivore, great. Some people are strict carnivore and still drink coffee. So are you really, really 100% only eating meat and water? That is it. If not, just cut that out, get down to that, get down to brass tacks. Also, you need to eat enough fat. Strangely enough, people say, oh, you got to eat less fat because the fat on your body, that's what your body uses. You're not eating it for energy. You're eating it for nutrition. And when you're withholding nutrition from your body thinks you're in a famine. And so it says, shut it down, lock down this metabolism. And fat is an essential nutrient. There are essential fatty acids that you have to have or you get sick and die. Essential fatty acids and also fat-soluble vitamins that you have to have, you get sick and die. So you need these things. And most people are deficient in these things already. And so now you're cutting out fat. That's a problem. You can also get too much protein. Actually, what's called protein poisoning. That's not good. Okay? That actually can be harmful and can make you very sick, make you lose your hair, make you do all sorts of nasty things that you don't want. Fun fact, when people eat more fat and as much fat as your body can absorb and actually reduce the amount of lean meat, that actually can trigger fat loss, right? Now, it may be that it's just too early, your leptin is too high and all that other sort of stuff. But if you're under eating fat, that actually can stall your fat loss. We think of it as fat causes fat, but that's not the case. That is not what happens physiologically. And if you're eating, the vast majority of your calories are coming from fat, and only 9% or less of your total calories are, and calories being a stupid metric, but this is how they measure it. So that's how we'll talk about it. Under 9% calories from protein, studies have actually shown that, if the rest of your calories are from fat and only less than 9% calories are from protein, you'll actually increase lipolysis because you increase FGF21, which is a hormone that increases lipolysis, and can actually increase your basal metabolic rate by 400 kilocalories a day. Just being in ketosis on a ketogenic diet increases your basal metabolic rate independently by another 350 kilocalories a day. Okay, so that's a big, big improvement on your basal metabolic rate and lipolysis, fat degradation, fat burning. And so this is sort of the basis of the sugar diet, where people go on the sugar diet. They're just a whole bunch of candy and sugar and nonsense like that, but they're also keeping their protein really low, right? And it's not about keeping your fat low and carbs up. It's about keeping the protein low, because they actually have done human trials actually showing that it's not about high sugar. It's about the low protein. And so when you go on low carb, high fat, low protein, you get the exact same result. People just dropping off a lot of their fat, their lipolysis increases because of this FGF21 response. But also it's even better because when you're in ketosis and you're high fat, zero carb, low protein, you're now in ketosis, and so you're not only getting that 400 from the FGF21, you're getting another 350 from being in ketosis stacked onto your basal metabolic rate, increased energy usage from your basal metabolic rate. So that can help as well. So there's a couple of tricks, but at the end of the day, you need to eat enough. You need to eat enough fat and enough protein. You just need to eat enough meat. So you eat fatty meat until it stops tasting good. You eat enough fat so your body is saturated and it's a body you can't absorb anymore. And so now a little bit's going to go out, and that's going to keep your stools soft. So you keep your fat content up so that you're getting very soft stools. You can stop before you get diarrhea because you're not absorbing it anyway. And but just make sure you're eating enough. You eat until it stops tasting good. The majority of what you're eating is fat, because that's typically we need more fat than we need lean meat. You get your nutrients right, your nutrition right, you get your vitamins and minerals, you add in a bit of liver every now and then. Most people are very low on nutrients anyway, especially at first, and so it can help you catch up. You don't need much, a couple ounces, 3 days a week is plenty. And then long term, you may not need any at all. You may not even need any to catch up. Most people do catch up, but maybe it takes longer. So if you're wanting to speed things up, that's a way you can do it as well. And yeah, so there's and just be patient. It's a long game. Just think about this like, look, you're doing this for your health. You're doing this for the long haul. You eat the way that you want to eat 30 years from now, when you've already reached your goals and then some, and you're just maintaining it. You don't want to try to eat in wholly different ways just to try to game the system, because you then have to come back and then where you left off at. then you're trying to change all your habits and eating ways, and things can get a bit screwy. So just eat the way now that you're going to be eating 20 years from now. Optimize it now, and then you'll lose weight. It will happen, and you'll be great. And then you'll be able to just keep doing what you're doing and just eating exactly the same way that you're eating, and you'll be able to maintain that fat loss and just perpetuate a healthy state for the rest of your life. Good luck with that. No Scope, thank you very much. 78 years ago, No Scope, thank you very much for the super chat. No Scope says, thank you for everything you do, Dr. Chaffee. My question is, why do people say to add salt, yet my knee pain when bending goes away and I cramp less without it? Because they're just sort of, yeah, you don't need salt necessarily. The reason they talk about this is because when you go onto any ketogenic diet, you're going to lower your insulin. Insulin has a role to play in sodium reabsorption in your kidneys. And so when you stop eating carbohydrates and you go ketogenic, your insulin levels start to drop. And now you're not going to be sort of retaining as much sodium as you may have before, right? And so it's thought that this could then, while your body's sort of readjusting, and because your kidneys do readjust, it's not like it's just insulin is the only signal. There's tons of signals, and so because people's insulin levels can go up so high, it can actually increase the reabsorption. Your body has to compensate for that and actually pull out more than it wants to, and then just to even it up. And then when you drop your insulin, all of a sudden your kidneys are pulling too hard, and then all of a sudden it's like rugs pull out from under it. And so you can maybe transiently lose more sodium than you want to. And so the thing to do there is, if you're getting, sort of drops in your blood pressure, dizzy when you stand up, all those sorts of things, add more salt, drink more water. That's fine. A lot of people don't get that. A lot of people don't have a problem with that. I just tell people the salt to taste. You don't have to add excessive salt. It's an excess. It's too much. If it doesn't taste good and you're just like, oh God, I don't want, it's probably too much, right? So just salt to taste. If you don't want to salt and you feel better without it, and you're not getting symptomatic, you're not getting low blood pressure, you're not getting dizzy when you stand up out of chairs, don't worry about it. It's eventually you won't need this. I mean, I don't salt at all anymore, really. It's it just doesn't taste good to me anymore. And animals in the wild don't really salt. Now they might go after salt depositions and things like that and lick at them and stuff like that, but it's not like if they don't do that, they die. I mean, if until people started putting out salt licks in their backyard, it wasn't like deer were just dropping dead from sodium depletion. But it's not necessarily something you need, or maybe even want, depending on the person. It sounds like you probably don't. You're getting sort of worse knee pain and cramping when you use it, then yeah, don't use it. So when you're having in more salt, also it increases your body's demand for water, which unfortunately can actually increase cramping, because a major cause, right, the main cause of cramping is actually dehydration, not getting enough water. Yes, it can be low magnesium, but it's more commonly low water. It's almost never low sodium. When people get low sodium, their brains turn off and they get very tired, very hard to rouse. They're very confused and sleepy, and they go into a coma and they don't wake up. Unless you correct that early and correctly. It's very dangerous to correct that when it gets too low, like very quickly. For instance, it's a medical emergency, hyponatremia. And hypernatremia, again, it can go the other way. You can get very confused and screwed up and all that sort of stuff. Your body keeps a very tight regulation on this. So you just not eating carbs one day is not going to just throw the train off the tracks. It's just not. It's your body has to be a bit more careful than that. But I never see people with hyponatremia. I've never ever seen them or heard of them getting like crazy cramps and things like that. Same with potassium. You get heart arrhythmias when your potassium gets too high or too low. So that's what you get. So if you don't want salt and it's not helping you, then yeah, don't use it. That's fine. William Seifert, thank you so much for the super chat. Friend diagnosed with ALS. I'm sorry to hear that. Doctors at Duke said to eat carbs and sugar to regain weight. Jesus Christ, don't listen to that nonsense. I told him about Carnivore. Please speak about Carnivore for ALS. Okay, so Duke is awesome. I love Duke. It's of all the places that I've worked, I think I was probably my favorite hospital. I was a sub intern there in plastics reconstructive and maxillofacial surgery. Loved it there. Absolutely brilliant, amazing doctors, amazing surgeons, brilliant people, and just technically just phenomenal surgeons there. So it was so nice to work there, and the ethos was great because there's just like any challenge, any problem, any mess up thing. You get people that had damage, they go to one hospital and they have a surgery and it didn't work out and things got worse. They went to the next hospital and same thing, and next hospital and same thing. We get this massive scar tissue and dysfunction, and we sit there for 16 hours and we just get the job done. And I didn't see a single case during that time that actually had like a failed case. We had a lot of failed cases come to us and we sorted them out. So they sorted them out. These absolutely brilliant surgeons. And they just treated everybody regardless of their ability to pay. They needed help. You got help, So I really like the ethos and the skill level and talent at Duke. So, not saying to disregard his doctors generally, but I think that carbs and sugar are a really bad idea. You don't want to regain weight. I mean, just first and foremost, let's not even talk about ALS. You don't want to regain weight. You don't need fat. It's not something that's healthy for you. You don't need intramuscular fat. You don't need intraabdominal fat. You don't need fatty infiltrates in your organs or around your heart. And you don't need to put on excessive amounts of subcutaneous fat. You don't need that. That's not good weight. It's not like your weight on the scale is now all of a sudden putting you in a different category unless you're just extremely emaciated. That's not a thing. He needs to put on lean body mass. He needs to put on healthy weight. So that comes from meat. That comes from protein. That comes from fat, from healthy proteins and fats from meat. And so, that's sort of the wrong way to look at it. You don't want to gain weight. You want to gain lean body mass. And it's very important, especially for ALS. ALS is thought to be more and more some sort of autoimmune issue. And people should go to my lecture on rethinking autoimmune diseases on YouTube. It's on the Low Carb Down Under channel. I'll be putting out my own version. That version with some addendums on it that I've had further thoughts since then that I think really contribute to the discussion. And when I get around to doing that, I'll add that and then post that. But it's available now anyway in its current form. And I don't think that autoimmune is autoimmune. I don't think your body's attacking itself. It's not. I don't think it's capable of doing that. And a lot of other reasons it doesn't make sense about that. But you can watch that on that lecture. As far as ALS, if it is an autoimmune condition, then this is something that is definitely worth trying with a carnivore diet, because autoimmune conditions generally improve dramatically with carnivore diets. You're removing the causative factor, I think, which is these plant toxins and lectins, glyphosates, these other sorts of things that could be contributing. And you just go down to just strict lion. You just go very fatty beef, lamb, and water, and that's it. And high fat, 2 grams of fat to 1 gram of protein. You optimize your B12. You optimize your vitamin D. You optimize your DHA, EPA, these sorts of things. And the animal versions of omega-3s, they don't come from plants. I have an MS protocol. I think it's on my website. I don't know where else it would be. Just dranthonychaffee.com. But Melissa, who's helping me out here, I don't know if she has a link or something like that can get to people, or maybe even like a link to my X or something like that. I have it up on my X. Anyway, there's a protocol that I have for MS, for optimizing MS, multiple sclerosis, that I've seen help a lot of people, and not only stop the damage from the MS, which is a demyelinating so-called autoimmune condition. You have to stop the damage first, but then you have to give your body the nutrients it needs to regrow the myelin sheath around your axons, myelination. And so you need B12. You need high optimal B12. You need way higher than the normal reference ranges, because otherwise you can't rebuild and regrow your myelination. You cannot. And so you need vitamin D as well. You need creatine. You need carnitine. You need choline. These sorts of things. You need to optimize your nutrition, and so give your body what it needs to regrow. You need to be in ketosis, because your brain optimally runs on ketones, and the ketones cross the blood-brain barrier, reconstitute into fatty acids that are used to rebuild the brain. They're used as the physical, sort of construction materials for the brain. And so eating a whole bunch of carbs and sugar will prevent that, and will prevent a very, very important nutrient for the brain, ketones, as well as the building blocks and materials to regrow the brain, ketones. But also you're eating a whole bunch of things that don't come with all those vitamins, minerals, and nutrients that you need to regrow the brain. And it's coming with a lot of things that could be contributing to the damage in the first place. So very well-meaning doctors there, very, very smart people, but unless they've got a randomized control trial with ALS patients showing that sugar and carbs is going to help improve their situation, I would do something else personally. And just from a mechanistic point of view, I don't really see how that would help nearly as much as being in ketosis and getting your body proper nutrition. There are people doing carnivore and ALS. It does seem to be something that's a bit more in vogue in ALS circles. I have spoken to a handful of people with ALS and MND that, motor neuron disease, and that are trying carnivore diets and seem to have had, at least preliminary success. Now, who knows? Is this because the body is improving just because of all the different ways that people improve on carnivore? And maybe it's not addressing the ALS, but at least they're improving to some degree and making it easier to deal with the ALS. But potentially, is it just that part of it, or is it actually helping the ALS? We don't know that yet. It would be anecdotal just in those cases, but we don't have anything else to go on at the moment. There are no studies showing basically anything improves this. And so, just any port in a storm, might as well give it a try. And if it is an autoimmune condition, I would bet dollars to donuts that it's going to help. And especially if you're very strict, beef, lamb, and water, high fat, and follow that MS protocol that I put out there. That's for any neurological issue. That's just how to optimize your neurological system. That's what the MS protocol is. And so it's definitely worth trying. Speaking to people with ALS and MND that are trying carnivore, they reached out to me because they were saying they're finding on the different forums of people with ALS that's more and more people are trying this now, and so they wanted to try it as well. And apparently they were saying, I don't know how accurate this is, but that about 20 or so people around the world have actually beat ALS and actually put it into remission. And this seems to be something that people are trying in order to do that. I don't know what those 20 people did. I don't know if that was with carnivore. It's just that generally there's a handful of people that have improved this. So there's some potential. There's potentially something out there that can help this. And so this is something that people are trying. So good luck to your friends. He's in very good hands at Duke generally, but we don't really know enough about ALS to actually do all that much. And I think from a nutrition standpoint, he's going to do far better with a ketogenic carnivore diet and following that MS protocol and optimizing his nutrition standpoint from a neurological perspective than he will just eating a bunch of carbs and sugar just to regain weight generally. You eat fatty meat until it stops tasting good. You do that at least twice a day. You try to exercise, you should put on lean body mass. And that's what you want. You don't want weight. You don't in the form of fat. You want lean body mass, and you want to be healthy. And eating a whole bunch of carbs and sugar, that's going to make you unhealthy. Maybe you'll gain some fat. You may not want that fat, but let's say you gain that weight. Oh, thank God he's gaining weight. But that's going to cause disease. That's going to cause more dysfunction. I can't say that it will exacerbate his ALS, but it's not going to help. And it can cause other issues as well, the carbs and the sugar. So if he's at Duke, maybe get in touch with Dr. Eric Westman and maybe see if he can help him follow him help him with a carnivore diet. I think carnivore diet, a plant-free ketogenic diet, so a carnivore diet is going to be the best thing for any autoimmune condition, because there are just lectins and plant toxins that seem to trigger autoimmunity. They just do. And so my patients with autoimmune conditions, they really can't handle any plants whatsoever, fruit, nuts, whatever, nothing. They just can't do it, and or without getting a flare up. And so it's really important, especially with ALS, to really, really, really go after this. And so, yeah, maybe just do that on his own, or talk to Dr. Eric Westman, who's been using ketogenic diets at Duke for 25 years, and he's got a YouTube channel, and he's a great guy. He's a really nice guy. He really cares about his patients. I've met him personally. I've spoken to him. He's one of those people that I think is very genuine. He genuinely wants to help people, and so he knows about carnivore diet. He helps people with carnivore diets as well. It's a subset of a ketogenic diet, which he is very well versed in, and so that's something that he could help with potentially, if he wanted some doctor supervision to do that. If he wanted to talk to me, I'd be happy to talk to him and just sort of give him my thoughts as well, and try to help him as much as I could, just in an advisory sort of way. Obviously, not being licensed in North Carolina, I can't treat him directly, but I can at least help him and advise him from that point of view, from a nutrition point of view. But Dr. Westman is right there at Duke as well, and he's fantastic. So good luck to your friend. I really hope that he does well, and if he does decide to do a carnivore diet, please let us know how he does, and he or she does, and him, about him, how that, tell us how he goes, and hopefully he does well. It's a nasty thing, and hopefully it's something that we can figure out, like we've seemed to have figured out other autoimmune conditions. So good luck. Okay, next question is from Jeremiah Comer. Thank you so much, Jeremiah, for the very generous super chat. It's very kind of you. Jeremiah says, going back on carnivore now, I struggle quitting dairy and coffee. Now 225 pounds, 5'10", used to weigh 170. Worried about gynecomastia. Want a doctor like you to guide and review blood work, etc. Do you recommend anyone in South Florida? I don't know who would be in South Florida. I know that Dr. Sivas he's somewhere in Florida. He goes back and forth between Idaho and Florida. He doesn't necessarily do full carnivore, but I think he's pretty favorable on carnivore, although he doesn't exclusively use. He does other things as well. But he could potentially help you if he's down there. I know Dr. Kiltz, but he's a fertility expert. I think he has a clinic down in Florida somewhere. But he's very, very well versed in carnivore. As far as blood work is concerned, it just you want someone who understands the optimal reference ranges. You want people that understand that the reference ranges from the lab are just averages, and those averages are better or worse depending on the area that the lab is in, and depending on how healthy those people are. But most people are sick, and most people are malnourished, and most people get blood tests because they're sick and malnourished, and their doctor is sending them to get a blood test because they're trying to find something that may be wrong. And so you're necessarily testing a diseased population. Not as helpful. And so you want to go to someone who, a lot of the functional medicine doctors, they understand, because this is part of the teaching, that these reference ranges are not optimal reference ranges, which is why we should not be using them. What's the point of looking at an average if everybody's sick? You're just saying, oh, look, hey, you're sick. Awesome. That's not helpful. And especially it's not helpful if the doctor's not understanding that when you look at your reference range, well, this is the reference ranges that we use. I'm like, okay, but those reference ranges are dumb. So why do you look at optimal reference ranges that denote actual good health? And then you can actually see, like, wow, we're radically out of balance for all of these different things. The hell? Okay, now we need to do something about it. So that's who you want to see. You want to see someone who understands that functional medicine doctors are more in keeping with that, may or may not understand ketogenic diets or carnivore diets. But they may be able to at least tell you reference ranges with blood work, and then you just do the diet that you think is most appropriate for you, and you have them help you with the review of the blood work and things like that. There are usually websites that have like lists of like ketogenic carnivore doctors. I know Dr. Kilt's website actually has a directory of people that do ketogenic carnivore diets, or use those sorts of things in their practice. And so there may be somebody near you, but again, just because those people understand carnivore diet, which is definitely a step in the right direction, they may not understand optimal reference ranges. So it's but at least it's your step in the right direction. So you could try that, and maybe you get lucky. Maybe there's a functional medicine doctor who does understand that sort of stuff, or someone who understands this in some other field that that is also knowledgeable about ketogenic and carnivore diets, and maybe you can find them. So that would be my best advice. If someone like Dr. Kilch or Dr. Sivas could help, then great. If otherwise, you can try to find maybe on Dr. Kilch's website, see if there's somebody around, or just try to find a functional medicine doctor that understands these optimal reference ranges, and then you just do the diet that you want to do, and you see them to help with the blood test side of things. And I wouldn't take any herbal supplements or anything like that they're selling. But I would, if you're deficient in a lot of medications, potentially some dedicated supplements to top those up, or really organs, just some some organs are nature's supplement. They're so nutrient dense and bioavailable. They're really, really amazing stuff. But they're sort of, think of them as medicine. Too much is not a good thing. And but when you're catching up, when you're deficient in these sorts of things, great. They're great for you. And then when you catch up, do you need them anymore? You can potentially go too high on some of these things. Most people on a carnivore diet will catch up with most, if not all, of their nutrients unless they have a malabsorption issue or genetic issue like MPHFR or something like that, where they're not going to be able to process these vitamins properly. So most people just going on carnivore, just eating meat, will catch up. And we'll be able to optimize that. Like I don't eat organs, I don't take supplements, and all my vitamins and minerals, I check them every couple of years. I'm just sort of getting bored of getting this just sort of optimal results. It's not going anywhere. So I don't really see the point in testing all that often. But every time I do, I'm in these optimal ranges of different vitamins and minerals and hormones and things like that. So I'm happy with that. And I'm just eating normal meat, right? Not really eating organs. But I have patients that can't quite get there. They have some sort of methylation issue or malabsorption issue. Those things happen, especially as we get older. So it might be something to do with decades of damaging your gut lining and its absorptive capacity with plant toxins and lectins. Don't know. But some people do have these malabsorption issues. And so even though they're eating fantastic diet, maybe even including organs, they may not actually be able to absorb all of it. So just keep that in mind as well. And good luck to you. Hopefully you find somebody who can help you. I mean, I'm able to help sort of interpret sort of reference ranges and things like that, sort of give you an idea of what I think is, a direction to go. From a nutrition standpoint, I can do Zoom consultations. I sort of don't have limited time, so I don't have very many slots available, but I still try to do that just in case somebody does need a hand with those sorts of things, above and beyond what they get for free out of my videos. But obviously I can't give direct medical advice, not having a license in Florida and not practicing there, but could easily give you ideas about the reference ranges and things like that. But if you're able to find a doctor in your area who's able to understand these things and help you one-on-one, that's obviously going to be a lot better for you, because it's just having that access is really important as well. So good luck with that. Hopefully you find something that works well for you, and I'm sure you'll be fine. The gynecomastia side of thing that typically just corrects and normalizes. I mean, if your estrogen is just way too high, sometimes you can be put on medications with your doctor to sort of tamp that down while your body's changing. But I can't tell you how many people I've seen that had young boys and even grown men that have had gynecomastia. before starting a carnivore diet and reversed it. And so when your hormones are normalizing and improving, that's gonna get better. And when you remove fat is actually your largest endocrine organ, because it actually has aromatase that actually converts testosterone into estrogen. So you get low testosterone, high estrogen. You can get gynecomastia just from being overweight and having excessive fat tissue. And so while you're burning that down, then that conversion reduces, and you keep more of your testosterone, less of it converts into estrogen, and that gynecomastia can actually just shrink down all on its own. So those sorts of things can often take care of themselves as well. So okay, good luck with that. Hopefully you get sorted out. Okay, question from Sammy Cass. Thank you very much for the super chat. When I work out, I get tired fast, and I feel almost like an excited feeling in my chest when pushing hard, doing dips, for example. Could this be hydration? It can definitely be hydration. And you may need a lot more water. Sometimes it depends on where you're at. Like if you're on, I'm assuming you're on a carnivore diet, or you wouldn't be here, but it's not everybody is. You have to sort of preface that. Some people say, they have these questions, and all of a sudden, oh yeah, no, I haven't started a carnivore diet. And you're like, okay, we'll do that. And but let's assume you're on a carnivore diet, a ketogenic carnivore diet. There can be a period of adaptation. And so, in that video lecture I talked about earlier, where I got ketogenic carnivore athletes, you actually see massive improvements in physiological markers, but also in athletic performance when you are keto adapted. So it takes 3 to 6 weeks to get sort of back to where you were, so you sort of have no drop in your baseline. And then at 3 months, McSweeney showed that people in ketogenic groups actually improved their athletic performance in endurance, 3-hour or 100-mile run, 6-second sprint, and a critical powerlifting test. So every way that you can move your body athletically, the ketogenic group beat the carb group. And this was with elite world-class ultramarathon runners and ultramarathon and Ironman competitors. Okay, so you can take a look at that. But there's this period of adaptation. And some people, that adaptation period can be a bit longer. Dehydration can certainly play a role in that. Sometimes low electrolytes can play a role in that as well. Again, there's this transition period. Some people may need a bit more electrolytes. Not everybody, but some do. And when you're pushing yourself hard athletically and physically, you might have an increased demand. And so if you're sort of a bit low on that, that can affect your energy levels. And so if you have a bit of salt, a bit of salt and some water, and you take that down, a teaspoon or something like that of water, some people have noticed that, well, hey, I'm feeling a lot better now, and I have a better athletic performance, and eventually your body sort of normalizes, and then you don't have that issue anymore, and you don't need the salt. But initially, that you might. So it depends on how far along you are. Excited sort of feeling in your chest could be from a lot of things. It's not all that specific, but just feeling tired in general. Proper adaptation. Are you eating properly? Eating a lot of fat. Training fasted, or are you training with food? If you're training with food in your stomach, you're going to tire out a lot quicker, because you have actually dedicated up to 40% of your blood supply to your intestines to metabolize and break down that food and bring it to your liver, and that's not available to your muscles and your brain, and so that can slow you down also. So I always train fasted, and I always feel better for that. Drinking a lot of water, potentially salt, a proper period of adaptation, so on. Those sorts of things can help. Check your vitamins, check your minerals, make sure all those things are adequate, and otherwise, yeah, just usually it's just a matter of giving it a bit of time. And yes, and hydration can 100% be an issue. So definitely drink a lot of water. Mr. Nell, thank you so much for the super chat. Nell says, "Hi Anthony, pre-med carnivore student here. Awesome, good to see it. Seen some creators claiming cooking meat destroys nutrients. Makes sense though through elimination reactions. Microbiology warned me against raw foods. Any thoughts?" Well, if you're not eating contaminated food or food that has, or meat that has much parasites. I don't see really too much harm in eating raw meat. The whole argument, I was actually just got into this online recently. I don't find that those arguments about cooking meat are any good. Honestly, I don't see them being good at all. First and foremost, because humans have been cooking meat for over 1.6 million years. So sorry, but whatever happens when you cook meat, we're well used to it. We are perfectly genetically, biologically adapted to it. Yeah, you do denature some enzymes and some proteins. You lose taurine and glutamine and those sorts of things, and others. Those are not essential for human beings. Meaning that you don't have to eat them to get enough. Now, some people don't make enough, and so it can be beneficial to getting more of that in your diet. Same with creatine, creatine and carnitine. Maybe you don't. You need a bit more, but even though carnitine isn't considered non-essential, some people don't make enough, or even make any at all. So you have to have it from your food. Okay, so if you're in that position with taurine and glutamine, maybe you're one of those people that don't make quite enough. Okay, great. You might benefit from that. There are studies showing that like more taurine in someone's diet is actually beneficial for a number of different reasons. Same with carnitine, carnitine. And the arguments that they make are pretty nonsensical, honestly. Things like there's no such thing, no carnivore in the wild cooks meat. Well, humans have for 2 million freaking years, right? So you have all these different sorts of people, like what was it? Let me try to find this for you. I actually had it written down. Anyway, all the different hominids and things like that, you Homo habilis, Homo erectus, Homo heidelbergalis, Neanderthalis, all the other different derivations of the Homo genus. They're all eating cooked meat, all of them, so there's actually copious amounts. There's billions of examples of animals in the wild eating cooked meat, and just because like that hurts their sensibilities, that doesn't make it any less true. So no, you have to eat raw meat. You don't actually. And some of these people are saying that you actually want parasites. That doesn't make any damn sense. Oh, that cleans out different things and that helps with this, that, and the other. And it's never been proven to cause disease. It has actually. It absolutely parasites have been proven to cause disease. Malaria. That's a parasite, and that absolutely causes disease. And there's millions of people die from that, like every year, from malaria. So people are just in denial a little bit, or a lot of it. And I pointed out, it's just like, look, people get parasites in their brain. They make these parasitic sacs that are in the brain, where it grows like a tumor and compresses the brain, causing seizures and neurological dysfunction. And you have to take those out, and you have clear neurological dysfunction at point A. You do surgery, you remove this stuff, and that resolves a neurological dysfunction. QED, that causes disease. Oh, it doesn't satisfy Koch's postulates for causation. Yes, it bloody well does. I mean, don't kid yourself. Just because you use big words doesn't mean you know how to use them, and you know what they mean. It's nonsense. So I think actually cooking meat probably was a survival mechanism, which is why it was so beneficial, and why every single example in human history and early human history, and all the different derivations of humanity prior to Homo sapiens, where we inherited from all of these other people, that there was some sort of survival advantage to this. Now you can actually open up and denature certain proteins. You can actually break down collagen and make that more bioavailable. So you make some things damaged, and you actually make other things more bioavailable. Great. So you can sort of break down and digest these proteins potentially at all, or potentially better. And they say, well, there's these enzymes, and so therefore it's better. Okay, where's the study that shows that? Where's the trial that shows that? Where's the study that shows that? Where's the biochemistry? It's just supposition. I mean, people are just making a claim that are unsupported. They're just saying, I bet you that this is true. Well, they might be true, But you can't just go around saying that it's a fact unless you have facts to present. You can't, this is a guess. It may be a good guess. It may be a bad guess, but it's a guess, and you don't have any evidence with which to test it against. So you're saying, well, these enzymes and this would help, and that's a theory. Okay, now test that theory. Does that actually happen? Because when you cook meat, you absorb 98% of it anyway. And when you cut out the gristle, you absorb 100% of it. So how can you get more and better digestion from eating raw meat than 100% digestion and absorption? Doesn't make any damn sense. So what they're saying doesn't make sense. And it's one of those things that sort of sounds good on when they say it, like, oh, okay, I can see that, because animals in the wild, they eat raw meat. Humans in the wild eat raw meat, but they also eat cooked meat. So the idea that cooked meat causes harm and disease and is a problem is just bullshit. It's throughout the modern day hunter-gatherer populations, like even the Inuit, they burn seal oil and blubber and whale oil and blubber and dung and whatever the hell else they can do, because they don't have plant vegetation and things like that to burn. It's not like you've got forests and stuff like that when you're up on the ice floes. But they've got fires and things like that, and they cook meat. They also eat raw meat. They also freeze that meat, and being frozen for a period of time kills parasites. And so that's what I was saying. I didn't finish that thought, but I think that did confer survival advantage, which is why every single human being, since before humans were humans, have been cooking meat, because it kills parasites. And so that's going to be, oh, but there's never been proven that. Yeah. It really has. It really, really, really has. And you go to the third world countries, you see people with parasitic infections, they get extremely sick. And guess what? You give them an anti-parasitic and it gets better. So is that anti-parasitic just doing something magic that just happens to kill the parasites and just happens to do this other thing that just happened to be the magic thing that was causing their disease? No, I'm sorry. That's way too much of a coincidence for that to make sense in every single case. And again, malaria, just like, go away. This is just that kills millions of people, and is extremely harmful. So the fact of the matter is, you can eat raw meat. I don't think there's anything wrong with that. If you're going to eat dodgy game meat and a bunch of trichinosis riddled bear meat, I would cook it. I would definitely cook that. I would not do that. So if you are and parasites cause disease in wild animals, all the time. Just study parasitology. I had a friend of mine who was a professor of biology, biochemistry at Washington University in St. Louis. And he was a parasitologist. He did his whole life's work were all these like really crazy cool ways that parasites like infect this animal, gets in their brain, changes their behavior, so they go up and sort of twitch and move like a fish in a certain way that like attracts a duck, and then that duck comes in, eats that fish, and then that gets its gets the parasite into the duck, which is actually what it was hunting after, and then it causes all these problems to the duck, and spreads its little minions all over the place, and ends up killing the duck. A lot of these parasites kill. We see this in the animal kingdom all the time. Different sorts of parasitic infections. Parasitic worms, invading into the brains of different animals and causing them to change their behavior, so that then they get eaten by something else, and then that worm infects that other thing. That happens all the time. And so, there's Koch's postulates. And it's just like, dude, your word-a-day toilet paper is not impressing anybody. All right, just because you learned a big word and you like to use it a lot doesn't mean that you actually know what you're talking about. So I, at the end of the day, I wouldn't worry too much about it. If you're eating clean meat, it's not contaminated, it doesn't have parasites and things like that. Doesn't get contaminated. Like, you'd probably be fine. And we've been dealing with those, certain bacterial load. We have our stomach acid is 1.5 pH. It's designed to deal with the high bacterial load. Does that mean it's beneficial to do that? Like people eating high meat and roadkill and things like that? Okay, look, you can do that if you want. I already feel like a superhero, and all my blood markers are optimal. So, even if that does, give you superpowers on top of that, like it's I don't need it, like, and I just doubt it. I'm sorry. I just, I'm not seeing that. And, just because we can deal with a higher bacterial load, just because we do have defenses against parasites, doesn't mean that being exposed to those bacteria and being exposed to those parasites is actually beneficial. That those are not the same thing. And so, just remember that. If you want to eat raw meat, go ahead. I mean, I eat raw meat sometimes. I eat cooked meat most times. But mostly what I do is I sear the outside of the steak. The inside is rare because that's my taste preference. I like that taste profile. So 90% of the meat that I eat is still raw. And I'm not saying not to eat raw. I'm just saying that I don't think you have to eat raw. I think it's not the case that no animal in nature eats cooked meat, because for millions of years, animals have been eating cooked meat. And so that's just not true. So a lot of these claims that they make are either not supported by any evidence, because there is no evidence to support it. It's just supposition, or it's flat out wrong, or mistakes, or lies. Like that no animals in the wild cook meat. Yeah, they do. You look up every hominid. Go on ChatGPT and say, give me a list of every hominid that's existed from Homo habilis to modern day Homo sapiens. You'll get a list of dozens species of animals that all cooked meat, all ate cooked meat, and and did so for at least 1.6 million years. And again, whatever happens when we cook meat, we were well used to it. It's been 1.6 million years. And the other thing to do is, this carcinogenic cooked meat. Don't burn the meat. I mean, it's like learn how to use a grill. And also boiled meat. A lot of that going around. Air fryers, these sorts of things. And also, this is again, it's not in keeping with the literature. The literature it's just not understanding that. We just say, well, there's carcinogens when you cook meat or when you cook anything. What have those studies been done on? They've been done on rats who have not eaten cooked meat for 1.6 million years like we have. We've been cooking meat over an open fire for 1.6 million years. We've had evidence of ovens going back 800,000 years, because we've seen this very even distribution of heat cooking these bones, like roasting big joints of meat and whole animals and things like that. Perfect heat distribution, which means some sort of oven technology. And we see this again and again and again and again. And so, we're seeing, this in the fossil record. We're seeing, all this stuff being, that we've been cooking meat for quite some time. And God, I forgot where that damn point. I lost my train of thought. God damn it. Anyway, I just lost my train of thought there. But in any case, I don't think that their arguments hold water. And that was right, the carcinogens. So the carcinogens, mice and rats have not been cooking meat and eating cooked meat for 1.6 million years as we have, and our ancestors have. So not translatable to humans. Then they gave them like 20,000 times the amount of these breakdown product, these so-called carcinogenic products from cooking meat or whatever, cooking anything, that we say, oh, well, now this shows an increased rate of cancer in cancer-prone mice that have never eaten cooked meat in their genetic history, certainly not for 1.6 million years. And again, 20,000 times the amount that you'd get from even a very, very burnt piece of meat. So it's just ignorance of the actual literature. I can tell you, I've never seen somebody who does understand biology, physiology, has a medical degree, or has actually read that literature, who says, oh my God, you have to do only raw meat ever. You know, you are going to lose some things. Great. Are those things essential to life? No, we know that. Why? Because people cook meat, and they have been cooking meat for 1.6 million years. And you know, if you want to eat some raw meat, I mean, go ahead. I mean, I don't think you're hurting yourself by cooking meat, not by any stretch of the imagination. So we had Elle drop by. Hello, Ellie Melly. Elle says, just came to say hi to everyone. We can't stay to chat. Hope everyone's having a lovely day, and thank you for supporting Anthony's channel. Well, thank you very much for that, and thank you all for supporting my channel. Appreciate it. Okay, so next question is sort of getting down to the last ones, and we'll sort of wrap up here in a minute. From Gunther SB. Thank you very much, Gunther, for the very generous super chat. I appreciate it. Gunther says, been 15 months of line diet, 2-to-1 fat to protein ratio in grams. I'll be traveling around for 2 months to places without keto options, but lots of whole foods. Will I lose fat adaptation? If so, how long can it take to get it back? First of all, unless you're going to like a vegan retreat, you can eat meat, you can eat eggs, and those are keto options, aren't they? Right? So you can just try to focus on those. I mean, I've traveled, you know, all over the world for conferences and different sorts of things, and you know, I ate meat, and that's it, and I didn't touch anything else. And sometimes that's a bit more of a pain than others, but there's always something you can do. There's always meat on the menu. You can always just find that. Sometimes it comes with sauces and other sorts of garbage, and didn't make me feel the best to have those as well, especially very sugary sauces. But at the same time, it's you know, it's still better than just going completely off course. So you can think about that. But either way, if you get if you're going to be sort of 2 months, okay. So let's say you can't find meat or eggs or something like that. But if you do find meat or eggs, just eat the meat or eggs, right? Easy. Just don't eat the other stuff. If you do dabble in different carbs and things like that, and you come out of ketosis, it can take a while, actually. I mean, you can. The thing is that, you know, when you're keto adapted, you're turning on and off different genes that allow you to utilize ketones, energy from ketones better. Okay. So because you're doing that, it's it's sort of a, you know, it takes a while. You know, it can take up to 6 months to get properly keto adapted, because you're turning on different genes. Those genes have genetic expression to make various proteins that then just build up in your system and cause different reactions, and can trigger and elicit other epigenetic sort of effects down the road. And then again, after the months, you sort of get this buildup, and then you get sort of this more proper keto adaptation. So just because it takes good 6 months to turn all that stuff on, you know, it's going to take a while to turn it off again too. You know, I don't know exactly how long that can take, but you know, it will happen. You'll start sort of turning down your ketone machinery on utilizing your ketones as effectively as possible. But you know, it can take a while to do that. And if you're at least trying to just eat meat and eggs when you have that available, and sort of avoid those other things otherwise. I mean, for me, it's just like, you know, if I don't have something that's healthy for me to eat, I just don't eat. You know, it's like I don't need to eat every meal of every day. I don't even need to eat every day. You know, if it's the choice between, you know, having a fasting day and not you know, and not having to eat something horrible, or eating something horrible, I'm not gonna eat. I'm like, no thanks. I'd rather not eat than eat something harmful to me. You know, that's just me. And I don't feel that knocks me back. I mean, I commonly, you know, when I was on call and things like that, thankfully I haven't been on these crazy calls in a while, but you know, back when I was, you know, I mean, you could be working, you know, 36, 48 hours or more without ever leaving the hospital and not having a chance to actually eat something. And it was fine. You know, I just dealt with it. I just had, you know, massive steak or two when I got home. And I pass out for however long that I had. But, you know, I wasn't going to just eat something. I don't have to eat. I mean, the amount of calories we have in our bodies. I mean, that 65 kilo individual with 6% body fat, that 6% body fat has over 35,000 kilocalories of energy, right? So you got a few weeks of energy, just that as a 65 kilo individual with 6% body fat. Well, I'm not a 65 kilo individual. I'm nearly 110 pound or 110 kilo individual. So like 230, 240 pounds. And I'm about 9% body fat. So I've got 80, 100,000 kilocalories of energy available. Like I'm fine. Like it's like I could go a month or so without eating at all and not even cut into my muscle tissue, right? And still have plenty of fat reserves to go. So it's up to you. But yeah, you will start losing that adaptation. Let's say that you were eating carbs for 2 months, right? You would start turning off those genes. You would start changing your genetic expression. You would change your protein profile that you were coding for and that you were building in your DNA and your cells. And you start changing, and then that gradient will start turning back the other way. You wouldn't be, I don't think at that point, again, we don't have any studies measuring this like we do actually on getting keto adapted. It takes about 6 months to get fully adapted. That I wouldn't expect you to be completely back to the drawing board at that point, but it would knock you back a few months. Maybe it talks you back to maybe you're at a 3-month adaptation or a 2-month adaptation, as opposed to being fully adapted. It's also the case that part of keto adaptation is you're improving your mitochondria, and you're doubling, tripling, quadrupling your mitochondria or more, and those aren't just going to all die off in 2 months. You may hinder them, but you're still going to get a lot of those benefits and effects and things like that. So to answer your question about how long it takes back, again, it's hard to say. One thing you could check is when you come back, you check your urea, or sorry, not your urea, but your uric acid. Uric acid is a pretty good marker of whether you're keto adapted or not, ketone adapted or not, because it competes for excretion in your urine with ketones. Uric acid and ketones compete for excretion in the urine. So it's actually a pretty sensitive marker of how keto adapted you are, because when you go into ketosis, all of a sudden you have all these ketones, your body can't use them properly, and you have to spill them out in your urine. All of a sudden, uric acid goes straight up. And this is how we know that gout's not necessarily just from uric acid, because 100% of people going on a ketogenic diet get increased uric acid in their blood, and there's a very poor correlation between serum uric acid and gout. And there's also multiple types of gout, causes of gout, and all they're called pseudo gout. It's not just uric acid crystals, and you can't actually tell the difference clinically. You have to actually stick a needle in the joint, which no one does, because you get punched or sued, or both. And so they just say, oh yeah, take some allopurinol, lower your uric acid. Not necessarily what you need to do. Not necessarily something that's going to help. Allopurinol is an anti-inflammatory. I mean, it just helps with a bit of pain relief anyway. But 100% of people going on a ketogenic diet, like a carnivore diet, will get elevated uric acid, or at least higher than what they were before. And then you'll see over time that'll sort of arc and come down. And it's usually about after 5-6 months that you get back down to your baseline. And so that's what you can think of as when your body's utilizing those ketones properly, and you're keto adapted. And that's why we say it's about 6 months. But it's happening the whole time. It's a gradient. And so you're getting better and better the whole time. Your mitochondria are improving, other things are improving. And so what you can do is you can check. You check your uric acid levels now, and then do whatever you do on your vacation or on your trip. And then when you come back, you check your uric acid. You go back on to ketogenic carnivore diet, and then you check your uric acid crystal, your uric acid levels in your serum, and you see where they're at. And then you just watch them and see them when they come back to where you were before you started all this stuff. And that can give you an idea as well. It's hard to say, but you'll probably set yourself back at least the 2 months that you've been gone, possibly more. And but you'll still have a lot of the benefits, like the overall physiological benefits, mitochondrial benefits, and those sorts of things. And you'll still be able to utilize ketones to a certain extent. I would doubt that you're going to completely lose your ability to process ketones to at least some sort of adaptive phase. So yeah, well, good luck with that, and enjoy your trip, and hopefully have a lot of fun, and good luck with that. So I have a couple new members. So Joshua, thank you very much for joining the YouTube membership thing. Hopefully that's something that's beneficial to you, and you guys enjoy. And thank you to Vernon Goetz as well for joining the YouTube group. If other people want to join, I just opened up the YouTube membership, just sort of get early video releases, have the different community people talking and chatting and being able to post in there. And then we'll be able to, again, so early releases of videos and sort of member exclusive sort of posts as well. And then on top of that, we'll start doing Q&As just for membership members. So when we get sort of enough people joining the membership, we want to sort of just open this up. Then we'll start doing Q&As just for the members, and so that'll be released then after the fact. But we'll still be doing the public Q&As as well, but we'll add in extra Q&As just for members. So if that's something that you guys want to do and have a bit more, close-in group with just members, then doing the questions, answers, things like that, you can join the membership group as well. Let me just see. This is probably the last one we're going to do here. It's from Hio Kalk, who says, our 3-year-old daughter is on an animal-based diet for severe eczema. The doctor said it's unsafe and we should add dairy, peanuts, and eggs to train her immune system, or she may react worse later. No, I don't agree with that. I understand where the doctor's coming from, but the idea is that from an allergy point of view is that they thought, like, well, don't expose your kids to peanuts and eggs and things like that within the first year, because if they have a reaction, their throat closes off, it can have it can be more likely to be fatal. And then they sort of came back around and said, oh yeah, no, actually it's better to expose them early because they might actually get a worse reaction later. There's no actual hard evidence one way or the other. But she's 3 years old, so presumably she's been exposed to these things. So it's not like that she's just never been exposed to any of these things. You don't have to keep exposing them to these things. That's actually not the case. Dairy, depends. Like if there's some raw dairy or something like that, maybe. Kids generally aren't supposed to have cow's milk, raw or pasteurized, until they're a bit older anyway, because there's just a very high amount of casein, and that can be damaging, deleterious to their health. And so, do what you think. But I mean, having a bit of cheese and all that sort of stuff, potentially. But the problem is with eczema, and the eczema can get worsened by the dairy. And so, what are we looking for here? I mean, this child is suffering with some eczema. It could be very bad. Some people have very, very bad eczema, and they can't tolerate dairy or peanut or even eggs. If she might be unsafe because she might react worse later. If she's reacting now, then that's something that you need to address now. You don't just keep exposing her to that and keep causing this problem if it is causing a problem. Obviously, that's not the right thing to do. So if she's doing better without all those things, I would disagree that she needs to be exposed to those things. She doesn't need to be exposed to those things. I mean, there's like, how many Inuit are exposed to peanuts? I mean, it's just, oh, well, they have to. Oh my God, they might react to it worse later. Well, then don't eat peanuts later. How about that? So yeah, I don't think that's necessarily the case. I mean, when you're reacting negatively to something, you're getting bad eczema, or psoriasis or Crohn's or whatever, and you eliminate these foods and that improves your symptoms and actually puts these issues into remission, and then you add something back in like dairy and it brings it back, well, that's a cause and effect relationship. That thing is causing that problem, whatever it is. And so, the thing to do is avoid it. If you're trying to rid yourself of lead poisoning, get rid of lead in your environment. And then if you get exposed to lead again, what do you know? You get lead poisoning again. It should not be a surprise, like that when you get exposed to something you have a reaction, that it's a good idea to avoid that thing and avoid that reaction, whether it's lead or whether it's peanuts. So, I mean, he wouldn't be saying like, if, she had an anaphylactic reaction to peanuts, well, you can't avoid peanuts, you got to keep doing it or it might be worse later. It's just like, no, she's having a reaction now. It's detrimental to her health now. So she should avoid it now. And so, yeah, I mean, just do what, is right for your kid. It sounds like your doctor's doctor is really does mean well and is doing the best they can to help out, and this is what they truly feel. But I would disagree with that. I think if she's getting a severe reaction to these sorts of food, and that's exacerbating her severe eczema, and you're saying it's severe, then that's significant. If it is causing the problem, then I feel that it's best to avoid those things, because she is getting a reaction. If you're getting eczema, she's probably getting other things too. She's probably getting other internal reactions that are could be just as bad or even worse. If you have one autoimmune issue, you often and are likely to have multiple autoimmune issues, because you're getting these plant toxins, and lectins and casein can actually cause leaky gut and allow these things in the first place to cause inflammation. That you get rid of those plant toxins, and and that stops the reaction. But so if you're having multiple autoimmune, well, because the thing is that if these lectins and plant toxins are causing the eczema and this damage to your body and eliciting that immune response, those lectins can bind to every tissue in your body, and so you can have immune responses to all these different sorts of tissues and organs, and you get very sick. You get very, very sick. And so the thing to do is avoid all of those things, and then the autoimmunity can go away. And so hopefully that it does. And but if you're seeing that certain foods make her worse, clearly that's very reasonable to stop exposing her to those things. Is she healthy? Is she eating well? Is she gaining weight? Is she moving on with her milestones and markers? Great. Then don't worry about it. You don't need to you need to change something. If it ain't broke, don't fix it. In fact, it sounds like the doctor's trying to tell you to break it. Like, it's not broken, break it. She's getting a reaction when she has these things, but you have to smash it. It's not healthy to be healthy. So that I think that's not maybe the doctor's just not sort of maybe thinking this all, or maybe looking at this in the way that I would. But if that were my kid and they were having a reaction to something, like I eat eggs all the time, my kid were reacting to eggs and getting eczema, like there would be no eggs in her vicinity. And sure as hell wouldn't be any peanuts anyway. I mean, that's those are just poison, and they're choking hazards, doc. But I would, that's just me anyway. But I think that if your daughter's getting a severe reaction to something, then you remove that something, unless it's necessary for life, which peanuts are not, and neither are dairy or eggs if you're able to eat meat. So okay. All right. Well, thank you all very, very much. I really appreciated that. We're able to go for about 2 hours today, which is good. I do sort of take a long time to answer some of these questions, because I like to be thorough, and I like to sort of give everybody a real meaningful answer, because I'm not just trying to churn through questions to sort of get super chats or anything like that. I'm just trying to help. And so I try to do these things in as thorough possible manner as possible. Unfortunately, that means I don't always get to everybody's questions, and we sort of have to shut down the questions at a certain point. But I've been trying. I've been trying to get a little better at sort of being a bit more, using a bit more brevity in answering these questions. But I think it's important, and I think that answering one person's question can also answer 30 other people's questions as well. And so hopefully that is the case, and so people have been found that useful. And thank you all for joining, and thank you all for joining for the new members that have joined the YouTube membership. People want to do that as well. I should have a link in the description. If not, I can put one in. But you can just go to my page and join. Should be able to join just by watching this. Should be a button or something like that. But you know, if you want to do that, then you're more than welcome. And yeah, so thank you all very much. We'll do another one next week, but probably at a different time. And I will, but I'll put that up and get my schedule together, because I have a few other things on next week. And I'll just see. We'll see what happens with the timing of that, but it should be at some point next week, and hopefully everyone can join then as well. And yeah, great. Thank you all very much, and I will see you next time. Thanks, everyone.